Thanks for joining us again. Today is session 2 of whole body vibration for fat disorders. I say fat disorders because it's not just normal fat. Part of why I'm doing a segment every Friday this month is to create some awareness. A lot of my customers over the years have dealt with lipedema, Dercums disease, things that diet and exercise just don't seem to reduce, whether it's weight, pain, symptoms associated with these disorders. So today we're going to go through a standing routine. If you are dealing with poor mobility, recent surgery, anything where you are unable to bear weight or should not be for long periods of time. Last week, our first session, I started seated in a chair. Today we are doing all standing positions. So if you are dealing with fatigue and want to join us today, bar height stool behind you, and at any time if you're finding you just need a break or a rest, sit your butt down in the chair and you can still enjoy the benefits by just exposing the lower extremities. I'm working on a pivotal style platform today, and the first position is just standing on the machine. I want your feet, if you are on a pivotal style platform, your feet closer to the center to start. One of the big things when you're dealing, regardless of the label that may have been placed upon you, if you're dealing with pain, fatigue, you just don't wanna. It's not about, standing as wide as humanly possible or going as long as possible or top speed. One of the big things with a pivotal style platform, it mimics the style of walking. If you're working on a vertical style plate where the whole thing's moving up unilaterally, you're gonna have a high and a low setting where the platform will move you up and down a further distance. On a pivotal platform, by starting with your feet closer to the center, whether you're standing or in a chair, you're going to reduce the amount of movement and the amount of impact. So it's kind of your control on the fly, regardless of what position you're doing on the machine, because you feel different from day to day. So today maybe you're having a good day and you're going to be able to walk a little faster, maybe a slight jog. Think of it that way. If it's a bad day and getting up to take a pee or going to make a sandwich is killing you, bring the feet closer, shuffle, very small movements. Today we are going to start, we want to make sure that the knees are just slightly bent. On your pivotal platform, I want you at a relaxation speed of 12 to 13 hertz. If you are standing too tall, I was looking at a group today answering some questions. Many of you experience neck and joint issues. Many of you are hypermobile. It's just one of the things that comes with conditions. And it's not about going the 3 times a week, 10 minutes. Make sure that the knees are slightly bent if you're able. The taller you stand, the more vibration travels up to the higher extremities, and you're kind of just like an A-frame. And you'll notice if I'm standing wide, in combination, it's all in your voice. If you bend the knees, it suppresses much, much more dramatically. So I want you no more than hip width apart. Today, I want to stress the importance of a feel-good session. The total of these 2 positions are going to be 2 minutes max. Could be as little as 30 seconds to a minute if you're suffering from fatigue. You can use your machine once an hour if you really want. A minute or 2 spot treatment or feel-good is not like exercise where you're pushing to fatigue. If you're doing true exercise positions, you're focusing on squats, doing some push-ups perhaps, and you have the ability to do more, it kind of falls into the ranges of regular exercise. You wouldn't exercise 15 times a day and push to fatigue. But something like this, especially for your lymph, your circulation, to boost energy, joint stiffness, maybe you need to go somewhere and feel better, or maybe you've gone for a treatment. You can also use any of this as a pre or a post treatment. So to start, we're just going to stand with our knees slightly bent. If you are feeling up for it, try a little pelvic tilt. Maybe moving those hips around. If you are dealing with chronic pain, you're going to be sitting a lot and it takes its toll. My plug today is about a fat disorder called Dercums Disease. A lot of people are aware of lipedema. In the grand scheme of things, very few people are. But lipedema tends to get all of the attention. We know about 11 to 12% of the population has lipedema. Underneath that, there's a similar condition called Dercums disease. And Dercums disease, I have references to make sure that I'm not offending all of my experts out there. And my experts are you guys, the ones living and battling with these conditions every day, and a few very special doctors. Dercums disease is a syndrome of painful growths of subcutaneous fat The fat growths occur anywhere in this fatty area. It can be from your scalp down to your to the bottom of your feet, and they're unencapsulated, very soft, sometimes occurring in small nodules, and other times are very difficult to remove in their entirety because of they have a very expansive growth. The onset of Dercums can be very rapid, or it can be insidious and progressive, beginning mostly often in your third decade, and fatigue and pain unresponsiveness just the meds are very common things with Dercums. It's one of those ones you go in talking to your doctors, they can see that you have, sometimes lumps and bumps, and, they just, aren't aware of the condition in the first place, let alone, how to treat it. And you've got to be really careful when you're going into some of these fat clinics, liposuction. If they're not qualified with conditions like lipedema, Dercums, you're just going to do more harm than good. We're going to progress now. We're going to lean over. And we're going to keep the feet even closer. We're targeting the spine and the hips. If you do not have a machine with handles, you just let your arms dangle, hang them here, put them on your hips. You want a good, nice 45-degree angle on your spine, which is where you're going to feel this primarily. And if you want more action, knees are slightly bent, just widen up the legs. I don't know how tense your back feels or what your pain is like. If you do deal with chronic issues in your spine, just in day-to-day, bring your feet close together and reduce the impact. So a little bit more about Dercums disease. There's going to be some more information that I'll be posting on a new page I'm starting, specific to whole body vibration disorders. I've had a really good response, so we're going to take some of this information and just start a little bit of a private page there. But the pain is very difficult to treat, and one of the big things with your doctors is they're going to give you those average, pills, if you will. I'm not going to name any, but they're not necessarily effective, and in some respects can cause and contribute to further inflammation and issues. Sometimes liposuction can improve the pain by reducing some of these growths, but unfortunately 50% of these items that are removed from your body will return in Dercums disease patients. So it's that ongoing cycle. If any of you have had surgery and been there, I empathize, because a doctor that doesn't understand this condition, they'll happily do the surgery again, but it's really not long-term a viable solution for you. Where really Dercums disease come from is still kind of unknown, although metabolic and autoimmune components have been proposed. So, in the midst of everything we're dealing with, autoimmune, the best way that you can deal with any type of chronic condition is nutrition, making sure that you're not stressing yourself out, worrying about this all the time. Get some sunshine, get some vitamin D. There's a lot of things we know we should be doing. Your vibration machine is going to be awesome for lymph, circulation, the two basic positions that I did today, 30 seconds to a minute when you need it. You move and lymph moves. So the biggest thing with Dercums disease, as with lipedema, that a vibration machine can offer you, regardless of what level or stage or symptoms you're dealing with, is like a supercharged, awesome lymph machine. If you've got a machine with capability to offer a higher frequency range, you can kind of get more results in less time. You're going to get some additional fitness benefits. Fitness is really about positions. So instead of just standing there, if you do want to, get stronger, fitness is not always about losing weight. Sometimes it's about being strong to carry that extra weight that we're bearing, be that physically or mentally. So, just evolving to a slight squat. We're going to get into some more fitness, a little bit more aggressive as the month progresses. But, when to do a fitness session, just like you would with regular fitness. That's more about you and your lifestyle and your choices. But, regular exercise, as I say, depends on you. Squats, a modified push-up, and some massage would really be all you'd need to be Dercums specific, lipedema, those type of disorders. And I want to ask if there's any related groups out there, lipedema, Dercums disease, MAID lungs. I know I'm forgetting some. There's a lot of different names, but tag some friends, share these posts. I'm trying to create awareness in a different fashion, and get more voices heard. And if I can help spread the awareness, I'm happy to do that. Put some links or questions in the comments. If you're looking for support and advice and you'd like some time with me, I do offer reduced fees. Send me a message via Facebook or drop a link, and I'm happy to share some information. Have a great weekend, everyone. We'll talk to you next week.